Hello, everyone. I'm Tanya Abreu, Chief Executive Officer of Power Up Nursing and all things in support of nurses. We are streaming live today, so that means bring your questions. Today, we're going to talk about something that always confounds me. Even when you have a corporate job these days, health insurance is not always a given. And what I find interesting, I have a good friend who just got a very nice corporate job, but has the opportunity not to use their insurance and take a segment of the money and purchase her own private insurance for her and her family. And because of her income, she's choosing to do that because she's using the marketplace. Well, let me tell you, I don't understand what all this means. I work for myself. I'm a 1099 contractor. I pay a lot for my insurance, and in a few weeks, I'm going to be able to choose again. And with Power Up Nursing, we have the benefit of having a partner, a sponsor, and a wonderful, wonderful person by the name of Leila Eslambolchi. She owns First Family Insurance, and you can find her, and it's here on my screen, LeilaInsurance.com. But I used to always really hate the fact that I had to talk to anybody who brokered insurance because it always seemed whatever I wanted wasn't enough. There was always some upsell. And it was never kind of a personalized process. And so when we brought Layla on, we said, look, about half of our nurses are also entrepreneurs, and they are struggling with huge bills to protect their health and their family. They have a lot of questions. They don't need hard sells, they need advisors. And so Layla said, I'll be the Power Up nursing advisor. So we are very excited to introduce Leila Eslambolchi, owner of First Family Insurance and one of the most knowledgeable people on healthcare insurance and the changes that are coming down the pike that you need to know about, as well as life insurance. But in today's segment, this live stream, we're really going to focus on okay, open enrollment is changing. For some of us, it's every 6 months, some of us, it's every month. I don't understand all that. So I'm going to bring Layla on. And the very first question I'm going to ask her is, when can we change our healthcare insurance? Layla, welcome. And anybody that wants to please put in the comments your questions, I will make sure they get to Layla. But in the meantime, welcome Layla to Power Up Nursing live stream. And would you please tell me a little bit about yourself? And then if you can, just go right into answering my first question. When can we change our insurance?
Absolutely. Thank you for having me again. Thrilled to be here, Tanya. Yes, so as far as background on me, I'm agency owner of First Family Insurance. We're a private health and life insurance agency. We specialize in private health care for individuals, families, business owners. Like I said, mostly 1099 independent contractors is what I specialize in. And as of 2 years ago, travel nurses has been my niche. So, as far as when to get health insurance, honestly, anytime. You can get health insurance at any time. If you do get coverage through your employer, obviously they have their open enrollment OEP periods. But now with the changes that are coming end of August, you're going to be able to get health care all year round.
All right,
However,
I'm going to stop you right there because most of us, and I was groomed in corporate America, and there was every 6 months we had open enrollment. But if you are a 1099 employee, or if you are an employee in the marketplace, or someone that is buying your own insurance, you can at any time call a broker and say, tell me what's out there for me. Yes?
yes, if you're trying to get private health insurance, but if you want to get the marketplace as of right now, you have to have what's called a special enrollment period if you're outside of open enrollment, which is typically November until January 15th.
Okay, so the marketplace, okay, that's another question. Explain the difference between the marketplace, which is also known as Obamacare, correct?
Yes, still.
Okay. The difference between the marketplace and private insurance
The
and
difference,
group coverage. Let's put all three of those in there.
absolutely. So the difference between marketplace and that of private healthcare or group coverage, we'll put them under the same umbrella because they pretty much are. You can get group policies through private healthcare. Marketplace are things that are plans that you enroll in, and your rate is determined off of your income, your household income or individual. So if you make above a certain threshold, you're not going to qualify for what's called a subsidy, where the government pays a certain portion of your premium. You're going to be paying full price, and those plans can be super expensive, as you know. They cover all pre-existing conditions, so they're not underwritten. So they're going to be required to cover by the state, mental health, maternity, drug and alcohol abuse, and any pre-existing conditions. Private health care, on the other hand, is written. You do have to qualify based off health. Your premium is determined based off of age, your zip code where you're located, differences.
Okay. All right. We have a question. I'll put it up on the screen. And I think this is what you wanted to talk about a little bit. Hold on. Let me get it. Okay, there it is. The question is, what happens if I have diabetes? How do I get the best doctors at the best price? All right, so someone's going to come to you. Let's say they are a travel nurse, or like myself, they're a contractor, have your own agency. You fill out a Schedule C. You may get 1099s from people, but in it, you're responsible for you. So somebody has diabetes. The question is, what happens if I have diabetes? How do I get the best doctors at the best price? What can you do for me?
Sure. So, because diabetes is considered a pre-existing condition, depends on what type of diabetes. If it's a diabetic type 2, there are some private healthcare plans available. Again, I'm only appointed with the carriers that I'm with. So, within my knowledge, there are a few carriers that will accept a diabetic type 2. However, if you're an insulin dependent diabetic type 1, you would not qualify for any private health insurance. The only health insurance that would be available would be through the marketplace.
But I have to stop you right there. I don't want to get into politics by any stretch of the imagination, but I have been hearing that the marketplace may be going away. What happened to people with diabetes and, pre-existing chronic disease, which, 1 in 3 Americans have, when there wasn't the marketplace?
First of all, I have to stop you there. Where have you heard about the marketplace going away? Because that is never happening.
Well, we hear more and more as, politicians talk about revamping the healthcare system, that the marketplace is expensive and that the marketplace is not efficient and it needs to be changed. So I really want to understand, what was it like before the marketplace?
Honestly, I don't know, because the marketplace has always been around as long as I've been alive. I'm 34. I've never heard of. It obviously had different names: Obamacare, ACA, which is Affordable Care Act. But to my knowledge, the marketplace has always been something that's been available, and for the very reason that it covers pre-existing conditions. We live in the U.S. Most people are going to have some kind of pre-existing. So I've never heard of it being done away with, or it ever not being around, to my
So
knowledge.
the government subsidizes it.
If you are at a lower income, yes, you have to qualify for that.
Okay. So explain this. Do you know what the income is for the marketplace insurance?
I do
The
not
guidelines?
on a spectrum, to be honest with you. It's too much to memorize, so it's a lot easier
Uh-huh.
to call Sherpa.com or healthcare.gov, which is the platform and tools that we use as brokers, and it automatically calculates it for you. So it's kind of tricky, and it would be exhausting to memorize. So we have the platform for that reason, because it's going to be based off the state that you're in. Some states have higher or lower subsidies, quite frankly.
Mhm.
How many people in the family, the age, things like that. But from what I've seen, standardly, if you make below 15,000 for one individual, you would not qualify for the marketplace. You're considered Medicaid, which is free
Mhm.
coverage. Above
Mhm.
15,000, it's still considered lower income, and you would qualify and probably get a higher subsidy if you're closer to that 15, 20K mark for an individual.
Okay, interesting. Interesting. All right. So let's talk about, can you protect yourself against denials? What kind, what, Okay, this is an interesting question. As a broker, do you help, you know, there are all different kinds of private insurance, right? There's all different kinds of private insurance. And most of them have some form of insurance also on the marketplace, correct?
Yes.
Okay. So let's just say, and they didn't say, what their income is or anything, but they said they get a lot of denials. How can you protect yourself from denials? I guess you probably don't know that question per se, but how do you determine what a good policy is for somebody? How would you walk me through what company I need?
Well, it's going to be based on a lot of different things. I kind of can just tell you. When I started out in this business, I had a script to pre-qualify, and now it's kind of just been made my own because it's been such repetition talking to so many people. You just make it your own. What I typically do in the first 5 minutes of talking to a new client is I ask them how often they go to the doctor, if they have a specific doctor they want to work with. So we'd have to search for that doctor, what medications they take, basically how they use their plan, and also their
Mhm.
budget, because rates are going to be determined off of the things I had mentioned, and I like to narrow down the options based on comprehensive coverage and cost to make it super easy. So we're not here all day. As you know, there's thousands of plans available. We could be here for hours going over. To make it easier, I narrow it down on those two things: coverage and cost, and then also how they use it.
Okay, and then somebody said people get ripped off all the time on Marketplace. So why would what does that mean?
I know, what do they mean by ripped off is my question, because
Mhm.
the only thing I can think of as ripped off is if they didn't get good coverage for the dollar or if they paid too much. But I can't control pricing. That's controlled by the government, right? So that's not something I can control. So I'm not sure what they mean by.
Oh, somebody got insurance on Marketplace with their social security number.
Well, you have to use your Social Security to determine that you're a U.S. citizen, because you have to be a U.S. citizen or have a green card to be able to get the plan.
So, but in general, you haven't heard a lot about Marketplace fraud.
Oh, goodness. I'm sure it exists, but I've never
Okay.
personally experienced it.
Yeah.
No.
Yeah. Well, I bet you there's a lot of unscrupulous because does the government pay the insurance company and the insurance company pays the broker? How does that work? I mean, I want everybody that's listening, oh, and we have a couple more people, to understand what is it to be an insurance broker? Why would I go to you instead of picking up the phone and calling United? What's the difference? What's your value?
The difference is United is just one company. They're
Mhm.
captive. So the term we use is captive. They don't have access to other plans. So they're going to really try to sell you hard on that product because that's all they have access to. The beauty
Mhm.
of the broker, and I'm sure you know, is being able to access all different types of carriers. For example, I'm contracted with 30 plus carriers in 40 states. If you speak with someone with United, 9 times out of 10, they're only going to be selling you United. If you talk to Florida Blue, they only have Florida Blue. They're not going to have access to all other plans, which limits your choices. People want choices. When they call, they want to know that they can look at all different carriers, because what if they give you a doctor and they've got 18 doctors they've used, and I've seen this, and only 5 of them accept United, and all you have is United? You're screwed. You don't have anything else to share. There's no other options. So
Okay. And then are there some things that, as we're choosing plans, it's funny because I had this happen to me, so I can use this and hopefully it's helpful to others. So I chose a plan that had a pretty high deductible, right? But had like very low deductible on pharma. And then it turns out that they really covered almost nothing in pharma. So I made the mistake of not asking beforehand if my regular medications were covered.
yeah, and who is this insurance carrier? Who'd you have, by the way? I'm curious.
It was United, but I
Through,
picked the wrong
through the market.
United plan. Yeah, United Marketplace. It's not
Okay,
private.
you do, and you currently now do have a marketplace plan, Tanya?
Yep. Yeah. Yeah.
Better than that, right?
I'm sorry. You you've
Do they cover you better than the previous plan? with the prescription.
Yes, but I pay $450 a month, right? So everything is more. But what I'm asking for everyone is, how do you balance deductible with pharma costs? What do you really want to look at? I guess it's if you don't take any medication versus if you're taking medications. Like I take, metformin is nothing, but when I'm type 2 diabetic, for instance. So if my A1C, for whatever reason, my pancreas is off, goes up high, I go on a drug I can't even say it, ibuprofen. It was previously called Byetta, and it is an injectable that helps the pancreas. And it's super expensive, like super expensive. Um, and so I took a policy that would cover that, right?
Yeah, I'd say
But
it's the I'd say it's the broker's job to be proactive and always ask those questions. So whoever sold you that plan, it wasn't your fault not to ask. You as the client don't think to ask these questions, right? It's not your specialty. So you have
Mhm,
call can be very tedious sometimes depending on the client's needs, and if
mhm,
you had medications that you shared with, it's their responsibility to look at those medications, make sure they're covered, how they're going to be covered, because prescriptions can be on tier 1, 2, 3, 4, 5, the list goes on, and sometimes certain carriers are not going to cover them by deductible or co-insurance. Some of them have co-pays, which is ultimately what you want. If you don't have a copay, you're paying out of pocket towards your deductible, gosh knows how much, unless you use third party, like have you heard of GoodRx or Single Care? Those are
mhm.
account plans that actually can help immensely lower costs.
Okay. Here's another question. What happens if my doctor switches insurance without letting me know?
Oh, goodness. Now, that's not something that can really be controlled or be proactive about unless they let you know. So you would kind of find out the hard way.
Mhm.
And then you'd
I
have to,
guess this person went to the doctor and then had a bill, right?
yeah, if it's switched
Huh.
after they enrolled. And doctors have the choice to do that. They can drop coverage at any time, any carrier.
So there's no recourse for this person. Let's say their doctor is no longer covered by Aetna and they have Aetna. Is there anything, is there an insurance company that's better to work with when it comes to making exceptions and changing and
Well, they can always negotiate with the doctor a negotiated rate if they want to be able to stay. This happens all the time. This is actually very common, unfortunately. So let's say
Mhm,
when I enrolled the client, Aetna was accepted by the doctor, and then the doctor switches. They're supposed to tell the client, but if they don't,
mhm,
and they find out later, they can negotiate the bill. They can go to the doctor and say, "Listen, you didn't tell me you didn't accept this insurance. You should have let me know so I'm aware." And there is
mhm,
they can switch. So if they want to
mhm,
carrier, I would just have to look into carriers that do accept the doctor currently. Call,
mhm.
sure,
Yeah.
put them in that plan.
Leila, I think this is a question. This is not, somebody didn't send this, but it's from me, and that is, um, what should you look for? What are some potential mistakes that people make all the time when they buy a policy?
Mistakes that they make. Interesting.
Yeah, when they come to you now as a broker and they say, Leila, I blew it. I did this when I bought it, on my own, or when I stopped at a health fair and talked to, Blue Cross, or what what kind of mistakes can we make and how does it bite us in our butts?
By trying to do it yourself, by going on the marketplace and delving into all those plans and not kind of understanding insurance, picking a plan based on cost and then not looking at the actual, like what it gives you. So some people just look at a
Mhm,
plan, they look at the dollar amount and the premium, and they're like, oh, I love this plan because of the dollar amount and the premium. But then they see the deductible is 10,000 and out of pocket max is 17,000, and it doesn't have any copays. So I'd say not instilling trust in a broker to do the legwork, because that's our responsibility, because we know what we're doing, and also making sure to be very thorough that doctors are in network, kind of like what we
mhm.
talked about before. It's a repetition of
Yeah.
that.
And I guess what agencies, at least in the good old days, and we so very rarely have this anymore. What insurance agents and insurance brokers were someone that people can trust, that would listen to them and work with them to find the best policy for their lives at the best cost, and to make sure that they crossed all their T's and dotted all their I's.
Yes.
And I think that's one of the reasons why the Power Up Nursing executive leadership said, yeah, let's bring on somebody that is going to just talk to our nurses, our travel nurses, our independent nurses, our entrepreneurs. And that brings me to another question. One nurse I just talked to recently hired two LPNs to work with her. They want to share, they wanted to know if she would share cost in their health insurance. How does that work these days? It used to be that you couldn't get a policy written unless you had like 50 employees.
Oh, you're talking about for group coverage, what's the minimal of employees?
Yes. Yeah. Yeah.
It does change based on carrier, but on average, from what I've seen for small business owners or even large corporations, the minimal is 10. So 10 employees to be able to get under the umbrella, because when you get a group coverage, you're getting a discounted rate, right? You're not paying what you normally would if you were to go individual. That's the whole point of getting that type of insurance.
Do people ever do that as families? So let's say the Eslambolchi, 20 people in your family want to get together and buy insurance through you,
Smart.
like a collective.
I've not had that happen personally. I can't say if you could or could not. I know there are qualifications and questions you answer in those applications for group coverage. And some of them are, what kind of business do you own? Is it an LLC, S corp? So you do have to qualify. And I mean, you could always be dishonest, but if you answer,
Mhm.
you'll be able to qualify for like a group plan if it's just family. It's got to
Well,
go.
I just know that a lot of our nurses are in collectives, right? They help each other, or they're NPs, nurse practitioners, and they're in a collective so that they can have bargaining power to buy things. So that's interesting, because I've been seeing more and more some of the professional associations, even the Travel Nurse Association, is bartering or insurance, right? They're saying, hey, if you join our insurance plan, it's going to be good for you. So it's interesting about the group coverage, and how much that saves. So I guess I think what's interesting is that income changes very frequently for 1099 contractors, entrepreneurs, independent contract nurses. So what they're looking for is a plan that's affordable at the peaks of their money making and at the low points of their money making. I know. Talk to us a few moments about the unique needs of travel nurses when it comes to healthcare.
Absolutely. And before I forget, I also want to remind you, I would love to go into the changes happening, because I know we're focused a lot on the marketplace, but soon, the marketplace will be the only options come into August. So I do want to talk about how people.
Okay, let's talk about travel nurses, and then we'll talk about those big changes.
So the for travel nurses, the unique needs typically are pretty much all the same when that comes to is contracts. So when travel nurses are on assignment, their contract can be anywhere from, gosh, a few weeks to 6 months to a year, what have you. What happens when they end contract? Their insurance ends, as you know. So when that happens, they have to bustle to find something else, and then look at potential rate increases, not happy with the care that they have. Sometimes insurance that I can offer them is more affordable than what the contract is taking out of their paycheck. So travel nurses are looking for a unique type of plan because they want a nationwide plan. Why? Because they travel all over the states. You can have a nurse that lives in New Hampshire, but she's going to California. What kind of plan are you going to get through the marketplace that's going to cover her there? None. They don't have marketplace plans, are just state based. So you want to find something that's a nationwide PPO,
Mm.
means they can use them in all 50 states, and it's PPO, which is the best network. It's a preferred provider, which means they can go to any doctor, any hospital in the country. So that's very beneficial for them.
And what is the difference between PPO and HMO besides the price?
HMO can be kind of a pain because it's not a very large network. Not all doctors accept it, so you have a limited network, one. Two, you need a referral each and every time you go to a specialist. So can you imagine that year, if you have a rough year and you break a leg, you need to be referred to another doctor or orthoped or gynecologist each and every time. You have to go to your main doctor, which is your physician, referring physician, PCP, and get a referral, and then you got to get it approved by the insurance. Make sure it's a headache.
Yes, I can understand. Now, you've been talking about this, and I've certainly been promoting uh, this question to our nurses and our entrepreneurs. What are these August health insurance changes that you keep talking about?
Yes. So with the election and everything coming up, there's a lot of changes that could be considered for the negative for some people, especially people that are healthier, that qualify for private health care. There are new options coming out, thankfully, that will be in place or still in place now that you can enroll in. So there's two types of options. There's private plans that are a little bit heavily underwritten that have a little bit lower premiums because they're so heavily underwritten and you qualify off health. Those plans are the ones that are going to be going away August 31st is the deadline. So you can enroll before August 31st, and I can't stress this enough to do so if you need health care, because what will happen is you'll be grandfathered into that plan and for up to 3 years. So you will not lose coverage. If you qualify now, you get it in July. You can keep it for up to 3 years, despite the rule happening in August, because you're already in that plan before
Ah,
expiration date. Now, if you don't qualify, let's say that you have a few pre-existing conditions, maybe you're healthy but like not whistle clean, right? Most of us aren't.
mhm.
There is a plan, I think I mentioned to you, America's Choice. I can't stress this enough. America's Choice is a plan that's been around for a while. They offer an array of carriers from Blue Cross Blue Shields to private healthcare systems. These are nationwide PPO plans that cover mental health, maternity, pre-existing. These are things that the current private healthcare does not cover. So it does have a
Hmm.
benefit for the rates a little bit more because it is considered a group coverage. So the rates are at a group coverage rate. So it's more beneficial to get it as a family with, three or more individuals than to get it as an individual. An individual rate would be a little bit higher. So
What's it called again? America's Choice? I'll put that up on the screen for us.
it's under the umbrella of America's Choice, and they're going to be using different carriers. The two main ones that I sell and I've sold the most of is Blue Cross Blue Shields and PHCS, which stands for Private Healthcare Systems.
I'm sorry, I'm putting this up because I want that to be the final thing on the screen. Contact Leila for information on America's Choice this month. And I'll put your website up again, leilainsurance.com. Excellent. Add this and put that up there. Yeah, that's a big point of it'll be problematic for a lot of people then. It can be very scary to lose your insurance. One of the biggest things I remember just absolutely being astounded by was when you leave your job or you're laid off or you're fired, you get this thing called Cobra, but it's so expensive. Like you can't
Or,
afford it. What
or
is that?
I have never really understood Cobra. I've never sold it. I know people that do, but unless it's a very 1% chance that you get a Cobra policy that's not super expensive, I highly discourage it first. It's very expensive. I've seen Cobra policies be as high as $3,000 a month for two people, right? And then, mind you, before that, they were spoiled because their employer was covering almost 75% of the premium, so they never saw
Right. Right.
more expensive than the marketplace, but it also only lasts for 18 months. So after 18 months, you're back to square one, empty handed searching for new coverage. So I
Mhm.
always encourage individuals that are in between jobs, laid off, fired, what have you, to look into private options if they qualify or the marketplace if they have a low enough income.
Mhm. Wow. Okay. Well, this has been extraordinary. I mean, nobody likes, except for you, Layla, nobody really likes insurance. We know that we don't want to have to use it, and we certainly don't want to have to pay more than what we need for it. But it's becoming increasingly a pain point for the average American, a true pain point, not just for our travel nurses or our independent contracting nurses or entrepreneurs in our world, but for everyone, even those that are working for school districts and hospitals. their share of insurance is growing. And many of those hospitals are giving allowances for people to go and um, find insurance elsewhere. I want to encourage everyone. Leila, can you give me your business phone number?
Sure, it's
I'm
804
sorry, say that again.
804
Uh-huh.
248
248
5819.
5819. I encourage you. One of the reasons why Power Up Nursing as an organization is endorsing Leila is because she is cool. She advises, she doesn't push. We've not gotten a single review of people who've spoken to Leila that says anything but, wow, I didn't know there was so much to learn and money to be saved and things to think about. So if you have any insurance needs, and I also want to say, we'll cover this another time, we have a whole life insurance. And what is that? And what is living life insurance? And what are death benefits with Leila? But for right now, today, we decided to, so many people are looking at August as times to look at insurance as well. It is critical just to have a conversation. It is, if you go onto her website, leilaiinsurance.com, you can schedule a complimentary health assessment, healthcare insurance assessment, or you can call her at 804 248 5819. So, Leila, thank you. Thank you. And please let us know when people call you, because I always want to support our partners and offer benefits to our nurses and our listeners and to our friends of Power Up Nursing that lead to a healthier, less stressful lifestyle. And having good insurance certainly does that. So thank you very much, Leila. And we will hear from Leila again soon. For those of you that stayed with us the whole time, I appreciate you. Please subscribe to us. It's www.powerupnursing.com to get more information on us, the programs that we have in wellness, in support, in vitality, as well as our partners who offer valuable life enhancing services and products to nurses and to nurses and to those who support nurses around the country. Again, thank you very much. Thank you, Leila. We'll see you again soon.